This segment of DelmarvaLife is brought to you by Peninsula Home Care.
Setting and maintaining the highest possible standards for health care. It's been the common factor with several agencies on Delmarva, and one that brings them together for a united cause.
Take TidalHealth Peninsula Regional and Peninsula Home Care, for example. They've been partnered for over 20 years now, and they continue to uphold an exemplary reputation, which is why we're welcoming this afternoon Beverly White, who is the Director of Operations with Peninsula Home Care and CHMG Solutions, as well as Brittany Banks, an RN Clinical Nurse Liaison. Thanks, guys, for being here.
Yeah, thank you
for having us.
So we touched on the venture between the two, the partnership. Why is this such a good match?
Well, I think the legacy, the culture of just TidalHealth in general for over 100 years has been totally steeped in community. And I think Peninsula Home Care embodies the same legacy. We are very community-centered, a very community-cultured agency. So the partnership just makes natural sense because we are serving the same population of patients.
Sure. So can you talk about some of the things you have in the works?
So absolutely. We are what's considered a ventured partner, a joint venture with Peninsula through TidalHealth for Nanticoke and for Salisbury. And there are other ventures in the practice with us. For example, some projects with Peninsula Orthopedic Associates, Peninsula Imaging, Genesis, Salisbury Genesis. We're all considered parts of the health continuum of the health services program. So we all work together collaboratively to make sure that it's kind of like when you go to like a super center, or when you go to a place that has multi-services inside, you're able to go there and have everything. There's some mutuality in there. Because we're all part of the same health system, if you choose to use TidalHealth at the hospital, if you go to Peninsula for orthopedic issues, if you use their cardiology practices, their lab services, their outpatient services, imaging, Peninsula Home Care, there is this shared information and this shared collaboration, sometimes even daily, that we're talking about our mutual patients. That means that you are staying within this health family that can offer you the best patient care because we are working together on a daily basis.
Yeah. Brittany, I promise we're not ignoring you. I promise we're going to get to you.
You're okay.
Just a second. Tell us about these education initiatives.
Patients and community and providers are craving for education for their patients. So Brittany became our RN clinical liaison to help us facilitate some of those projects.
Yeah, so one of the programs that we have with Peninsula Home Care are for our patients that have heart failure, or CHF is a common term that you'll hear. So what we do is we send equipment for them. We have a scale, a blood pressure cuff, pulse ox, and we also provide what we call a binder. So it's just a consolidation. There's a log, patient education, important for CHF patients, like low sodium diet and such. And we go out there and have our nurses educate them on taking their vitals every day, because that's very important. If there's a change, if they become short of breath, or they have a weight gain, or they notice swelling in their legs, it's really important to let us know about that, and then we can collaborate with the cardiology office to come up with a plan for them. So we're really excited.
You mentioned some specific things there. What are the most common questions that you get from people wanting to know?
So what their symptoms are is a big question that we get, what to look out for. A lot of patients that have heart failure don't understand that when they get the swelling, or they notice that they're a little bit more short of breath than normal, that's what that can mean, is that they're holding on to extra fluid. So that's a big part of our education piece. Or even when their vital signs go out of whack, as we call it.
Right.
Their weight goes up, their blood pressure goes up, their pulse goes up, their oxygen saturation is off. So we just try to teach them all of those things. That way they can call us first. We're trying to be a little bit more proactive than reactive. So if we can get them to call us before it gets really bad, we can save them from an emergency room visit.
Yeah. The goal to keep them out of the hospital
and
at
that
home.
is a big goal for us.
Yes. Beverly White, Brittany Banks with Peninsula Home Care, thank you so much for coming in and telling us about this wonderful partnership.